Here, in Broward County, Florida, the mortality rate from COVID-19 is a little more than 1%. But, the mortality rate varies within the United States. The question is, why does the mortality rate vary? Is it because of race, or class, or something else?
What I experienced this past month there was horrific. I don't know. So of course, I was in El Paso, Texas. For some reason, the doctors there did not aggressively treat those COVID patients as they should have, as I have experienced before. So I saw a lot of people die that I feel like shouldn't have died. Y'all, that assignment there broke me. I was put in what's called a pit. And in this pit was 8 patients, all COVID positive. My first day of orientation, I was told that whatever patients go into the pit, they only come out in a body bag. And because they were COVID positive, this hospital's policy was they only get 3 rounds of CPR, which is only 6 minutes. Out of all the codes that we had there, there's not a single patient that made it. Y'all, the morgue was so full of bodies that they had ran out of room. So once the doors open to the pit, they come wheeling in a body already in a bag, lined them up with the rest of our alive patients, because they had to store the body in there because the morgue was out of room. They've had to bring in freezer trucks because there's so many bodies. I remember calling a doctor one night, and mind you, we as nurses sit in this pit for 12 hours. The only time that we in full gear, the only time we leave that room is if we go to the bathroom or we go on our 30-minute lunch break. I remember this man bleeding profusely, and I remember calling the doctors that was there. Y'all, to have a doctor tell me we don't come in those COVID rooms, I'm like, what? Y'all, the doctors don't even step foot in those COVID rooms to see those patients. I was there almost a month. I never once saw a doctor come in that room because they were COVID positive. Y'all, I feel like the treatment that those patients there are getting, when I say it did something to me, I literally, the first hour of my drive home, just cried. We as nurses, it's okay for us to be exposed. But you as doctors, you do not even come in there. You can't get exposed, but we can. And y'all making all the money. Okay. Why is Texas not being broadcast like that? Texas has surpassed New York. We had 4 freezer trucks. 4. They had to show up because it was so many people dying. If those doctors there would aggressively treat those patients from the beginning, a lot more would make it. Y'all, and the saddest part about it, my first night there, as I was getting orientated, the nurse that orientated me had one patient that was called the VIP patient. She was a doctor's wife. And when I say they pulled out all the stops for that woman, it wasn't nothing that they didn't do for that woman. And guess what? She was the one patient that made it out of that ICU alive and was able to downgrade to a long-term acute care. So you mean to tell me because she's a doctor's wife, her life meant more than any of those other patients?
Watching this video, I'm reminded that the ineptness, deniability, and mismanagement of the White House has trickled down into all sectors of society. A lack of leadership has its cost.